Today is part 4 of the 4-part series entitled 4 Strategies for Becoming a More Effective Educator. Recordings from the other 3 webinars will be made available to you soon on the eValue homepage. And then today's presentation is entitled Adapting Precepting Methods to Meet Student Needs. And our presenter is Dr. David Cluck, who's an associate professor of pharmacy practice here at the College of Pharmacy. And with that, I can turn it over to Dr. Cluck.
Thanks, Susie. All right, we'll go ahead and get started. We're going to be talking about precepting methods to meet student needs. So let's jump right in. Okay, so identify common challenges in precepting students. Discuss educational strategies to improve student performance, and then determine some ways to customize experiential learning based on student needs. And some of these we'll talk about quite a bit more than some of the other objectives. And then I have, right at the very end, maybe one other thing just to tack on. Okay, so here's my disclaimer. When I was putting this presentation together, I was stunned as to how much data isn't really out there, how much literature really isn't out there. And so one of the papers that I found actually had this quote. So there's really a paucity of recommendations in the published literature that addresses identification and optimal management of challenging trainees or managing challenging trainees in pharmacy experiential education. ACPE says, we want you to do it and we want you to be effective, but they don't really give any guidance. And so a lot of what you'll hear today is really, there's some literature behind it, but some of it's just my experience and what's been successful for me. Okay, so the first question, what is the biggest challenge for you as a preceptor? So I listed a couple here that are pretty common. If you choose E or other, I would just ask that you specify what your biggest challenge is. Okay, travel, that's unique. So it seems like for the most part, I kind of saw a smattering of everything. Not many people, let me scroll back here, not many people chose professionalism issues. So we'll talk about that a little bit. Training and time constraints. Yeah, we'll talk about some of these things as we move forward. I just wanted to get a sense of what your biggest challenge is. So here are some of the most common challenges in precepting students. Knowledge deficits, and that can be far and wide. Certainly, students who come on rotation, on your respective rotation, they may have really large knowledge deficits, some that you feel like you can't correct during the time they spend with you. And that can be a challenge. Unprofessional behavior, so that'll come up a couple times in some different places, but that's usually pretty easily corrected. One of my favorites is lack of interest, or what I've heard one preceptor refer to it as academic tourism. And that is they see you in action. They see Dr. Stewart in action on the family medicine service making interventions, and they think, wow, look at that guy go, he's great. But they're not really interested in engaging. They spend time on Dr. Lewis's rotation, and they think, all this ID stuff, I'll never get it. And so they spend more time kind of watching you be you, and not really engaging. And really what I like to do on my rotation is I'm your safety net. I want you to truly practice, get used to and comfortable with making interventions and recommendations. And that's part of the evaluation usually at the end. One that I think some people struggle with sometimes is student mismatch. And what I mean by that is you have a really good student and a student maybe who has more knowledge deficits than the really good student. So how do you offer a good rotation experience for both students while not really neglecting one or the other? And that's a challenge. There's some things you can do, and we can talk about that if we have some time at the end. A lot of you guys chose integration into your practice. And so one thing that I think to me that is worth discussing is students are not you. I think that's important for you to realize as a preceptor. They're in training. They do not have your knowledge base. They can't make the interventions that you can make. What I usually tell students, while I want them to practice and make recommendations, usually they need to run by the recommendation, run it by me before making that specific recommendation, unless it's very obvious. So duplication in therapy, 2 beta blockers on board, 2 proton pump inhibitors on board. That's something that they should feel comfortable saying, hey, are you really sure that this is what you want to do? But integration into your practice is easily very high on the list of common challenges. Overconfidence, I don't see this one too often, but it is out there. So you can have some students who come on your rotation who can be overly confident. And usually that's something that I think is much like the unprofessional behavior, easily corrected. Preconceived ideas. So this kind of goes both ways. One of my favorite questions to ask on the first day of rotation with me, what have you heard about this rotation? Students can be as open and honest as they like, and there's no repercussion, and there's not any repercussion ever. I want that feedback. I want the feedback that what are you hearing about my rotation, about me as a teacher, so I can get better. I think students who are actually with you on rotation are more likely to not give you true and open and honest feedback because they're afraid they're gonna penalize you. Other things about preconceived notions, one student asked me one time, do you have any preconceived notions about students coming on rotation? And I kind of sort of maybe told a fib and said, not really. But I think all of us do. I think all of us, especially the faculty members who've had the students in class, we usually have a good sense of, this is a really good student. I think they're going to do well in the rotation. And most of the time that pans out, but sometimes it doesn't. And other times it's on the opposite end of the spectrum. It's a student who's been in class who's very, very quiet, who comes to your rotation. I've had plenty of experiences where I barely knew the student's name in class because they were just so quiet, sat in the back, never made a sound, and then came on my rotation and they were great. I really enjoyed having them. Expectation versus reality. So I think this sort of circles back to integration into your practice. One thing I struggle with is when I give a student a project or an assignment, I have a vision for what I think that's going to look like. But just understand as a preceptor that, again, students are not you. If you have very specific points you want to hit on, tell them that. But sometimes there's a mismatch in terms of what you expect and what the reality is. And so I'd ask you guys, any others you can think of, any other challenges maybe that you thought of as I was going through all of these that you want to add? We'll move on then. So there is a fantastic podcast by the Curbsiders. If you listen to podcasts and you've listened to the Curbsiders before, they're internal medicine physicians, and they had a recent podcast that I listened to a little bit of, and it really is more applicable to medical students. But it talks about identifying the struggling learner. And I think as we've talked about, most of your learners are going to fall into, that are struggling, are going to fall into one of these buckets. Professionalism issues, something I tell students on day one, whether you like it or not, you're a reflection of me, you're a reflection of the College of Pharmacy. So be respectful. Don't be disrespectful to team members. Doing things that, students might perceive to not be disrespectful really are. So if you come into rotation, you come into rounds late, you've got your breakfast and you're really disruptive, that's unprofessional, that's disrespectful. And really it shows that you don't care about what's happening there. Another example that I've had on rounds before is some students sleeping during table rounds, also inappropriate. Being defensive to feedback. I think feedback is important, especially constructive feedback. So, it shouldn't be really damaging or overly critical feedback. It should be constructive. But, some students sometimes can be defensive to that. Dressing inappropriately. I personally haven't had an issue where I've had a student who's been dressed inappropriately. That can happen from time to time. Knowledge and synthesis, I think, is probably where we see most of the struggles. So maybe they're less knowledgeable than some of their peers. They can't really reason through and maybe answer some of the higher order questions. I think, when students are on rotation, that's really when things should start to assimilate. Things should start to kind of click. Doses start to make sense. You see common doses. So putting it all together in the fourth year, I think, is really important, and that's where it should happen. But sometimes, there are some deficiencies that we have to adjust and correct. Organization. One thing I think some students often struggle with is rotations are not the classroom. They're very different than the classroom. And so you can see some struggles with time management or study skills. They can't triage things appropriately as it pertains to working up patients. They can't perform routine tasks. They feel, overwhelmed very easily. We'll talk about, this will come back in a second, but I think if this is a weak point for a learner, especially if they're pursuing postgraduate training, then they really need to improve, and you need to intervene sooner rather than later. Lastly, communication. I do have this problem from time to time with some students, not routinely a language barrier, but maybe they use informal language or being overly timid. And I'm sure all of us have had students on rotation who don't really interact very much, very, very quiet, may not speak the entire month. That's really something that needs to be corrected. Again, I think there's value in just learning to interact with other healthcare professionals, whether it's a PA, a nurse, a resident, an attending. I think that's a skill that we often don't really focus on. Unable to read social cues. Sometimes this happens. It can make things awkward for everyone, I guess. But I don't really usually have a huge problem with students not being able to read social cues. Okay, so setting the foundation for success. So as I was doing my research for putting this topic together, I came across a very nice paper from Lindsay Davis, who's at Midwestern. And she's done some great things in terms of preceptors and preceptor development. And so in this paper, and the reference is shown below, they kind of broke everything down into 3 different tiers. And so primary prevention, which is something I'm pretty sure most of us probably do. But if you don't do this as a preceptor, it's something you should really consider. And the first thing is a rotation syllabus, which most all of us have, but having a calendar. Just letting students know what the expectations are, when you're going to do a journal club, when you're going to have a topic discussion. I think it's very, very helpful. And maybe you can prevent some of those time management skill lapses if you provide a calendar early on, first or second day. Mutual goal setting. So, tell the student what you want them to do. Make sure you're very, very specific in terms of what you want them to do. It's going to really prevent a lot of the problems that could occur downstream. I'm going to skip over secondary prevention for a second and go to tertiary. So tertiary prevention really happens probably beyond the level of the rotation. That's something that the Office of Experiential Education will likely deal with if there's tremendous problems. Secondary prevention is probably where most of us would try to intervene. So teaching strategies associated with poor performance. And we'll talk about some of those in a few slides. So I wanted to throw this slide in there. This is more, some of you are probably very familiar with this one, the preceptor teaching roles. I know Dr. Stewart is. I think I've probably seen it in one of his slide sets. So just realize, I wanted to put this in here, and this is more applicable to residency training, but realize that in the learning pyramid and the preceptor's role, for students in the learning pyramid, you're probably going to spend more time in the foundational knowledge and skills and some of the practical application, and really lesser so in the integration. Maybe some, but not as much. From a preceptor standpoint, probably more time in the direct instruction and the modeling, maybe some of the coaching, maybe lesser so in the facilitating. It really depends on the student, and there's a lot of other factors that go along in there, but I wanted to share this slide if you haven't seen it before. Again, I think with most students, you're probably gonna stay down around the bottom of both of them. Okay, so another interactive question for you guys. How do you assess student performance at your practice site? Is it graded assignments, perceived knowledge? So the student seems like they know what's going on. Do you stick to the E-value rubric? Historical student experiences. So maybe you've had a lot of students who've been on rotation. They all seem to do fantastic. And so you kind of base your assessment based on previous students. And I think that's a challenge for a lot of us, or other. All right, looks like for a lot of you guys, it's a combination of things. So one person added attitude and effort. And I agree, those are important. All right, I see. I see several A's in there. So we'll talk about that. Maybe I'm behind the curve. There's not a lot of graded stuff that actually happens on my rotation, but we'll talk about that. Okay, so here's another couple interactive cases for you. So you have a fourth year pharmacy student who comes to your internal medicine service in March. And the month is important because that tells you that they're a couple months away from graduating. They've spent the last month in an ambulatory care clinic. The student appears very motivated, but the attending actually comes back and says, you know, that presentation they gave on oral drugs for diabetes was really poor. So how would you handle this student? Okay. So Dr. Gray says, ask the student how they prepared and what resources they utilized. All right. Ask physician who he's comparing the right student to. Yeah, okay. Ask the attending for specific examples of why they felt it was poor. So a couple of good things in there. So here's a different case that might be more applicable to some other preceptors. So you have a fourth year pharmacy student comes to a community pharmacy rotation after spending the month on the internal medicine service, already has a job lined up with your company, but you notice the student's effort has been really, really poor. They've been lazy. In your 3 weeks into the rotation, and the 3 weeks part is important because it's past the midpoint. So how would you handle this student? Yeah, Tom, I agree. Assign another presentation to the student for delivery to pharmacy staff. Yeah, I agree, Carmen. Discuss job expectations. All right. Sorry, I had to move around for a second. Yeah, I think there's a lot that could be discussed really with both of these cases. Obviously, setting expectations for what it's going to be like, and then for the first case, there's a lot of different ways you can handle this. I would have a discussion. I think the red flag here is that you're in March. You basically showed that you didn't really get anything out of the last month. I think that's a little bit concerning. So that's the red flag to me, that you're a couple months away from graduation. And it seems like there's a lack of retention of knowledge. All right. So assessing student knowledge. So here are some of the things that really I've done over time. You know, some of these, and certainly feel free to chime in. I'm sure there's things that you guys have done on your rotations that could help everyone. So I'll just kind of walk through some of these. Rotation reflections, pre and post. So pre-rotation reflection. Typically I ask students on day one, you know, you're going to spend the next month with me. Just sit down, take 20 minutes and tell me about who you are. So the first little bit is really about who you are, where you're from, where you went to school, undergrad that is. And then the second part's more academic. What do you want to get from my rotation? What do you want to get from me? What are your strengths? What are your weaknesses? Why did you take my rotation? What are your plans after graduation? I think all those things are important in terms of shaping the rotation for the student. And then also ask students at the end to send me a post-rotation reflection. And the post-rotation reflection really is just a streamlined, to me, evaluation. You know, it's allowing the learner to sit down, the student to sit down and, you know, take 20 or 30 minutes. Tell me what you didn't like, tell me what you liked. And then also, I think if there's a disconnect, you know, if I have them evaluated to be a C student and they say, you know, I think I did excellent on your rotation, then I think we have some things to discuss, because I think that's an important skill. Learners need to be able to have some self-awareness, some insight. And those learners who lack insight, to me, are some of the most dangerous learners. Some of the things in terms of assessing student knowledge that I do on my rotation also are chalk talks, and there's lots of different phrases for these. But You know, essentially I pick a topic and I say, you know, in 9 minutes, tell me everything you know about influenza. You can't use any notes. I just want to see on your, at baseline, what you really know. I don't want to give you a heads up and, you know, you come back and you read me a package insert or a chapter out of DePiro or Harrison's or whatever. And so students tend not to like these very much because it puts them on the spot, but I do think they're very effective in terms of seeing their baseline knowledge. Self-assessment tools. So I frequently have PA students and sometimes medical students with me as well as pharmacy students. And so I usually have a pre-rotation self-assessment tool. And so it's just 10 questions. It takes me no time to write 10 open-ended questions. And then again, much like the chalk talks, kind of gives me a sense of what those students know and what they don't know. And then sometimes I will give a post self-assessment tool or self-assessment just to kind of see, you know, what do you retain over the course of the month? And you spent time with me, you know, you listen to your peers, journal clubs, topic discussions, you know, were things going in or, you know, were you not really absorbing anything? Use of rubrics. I haven't seen a journal club rubric in quite some time. I know the Preceptors Network or Preceptors Toolbox at one point had a rubric for journal clubs. This can actually be really effective. It makes the learner, requires them to engage in their peers presenting the journal club. Journal club debates, you know, that really fosters some deeper or higher level clinical thinking. Learning logs actually was something I did as a student where you just carry around a notebook and every week, once a week, you would turn in what you learned throughout the course of that week. And the preceptor would look at it. And it couldn't be just all over the place. It needed to be really a true reflection of what you learned and places for you to grow. And I think that's important. And we'll talk about that more in a second. And then the 1 minute preceptor, which really is an opportunity to provide some feedback to students. I think I have a breakdown of that. So you're assessing what they know, but also giving them some feedback about their knowledge base. And so this just kind of walks through some of those micro skills. I'm not going to walk through it because we don't have time. And certainly if you want a copy of these slides, please let me know. I'm happy to send them to you if you want to look at them a little bit closer. So here's what's referred to as Steinert's solution. And this is really a framework overall that I think is pretty actually insightful. It asks the preceptor really to consider the problem from all angles. That includes the perspective of the trainee, the teacher, to recognize, you know, factors that might facilitate some of the trainee shortcomings. And so, you know, I think about the VA, for example, as being particularly problematic. You know, their system is a little bit different and it takes some time to get used to that. So really this framework asks you to do that, to consider maybe some reasons why the trainee might not be successful or the student might not be successful. We've talked about knowledge gaps that, you know, you're going to uncover those. So at the very beginning, you'll maybe identify some knowledge gaps, but you'll probably identify some throughout the course of the rotation as well. And there are ways, I mean, if a deficit is tremendous, there are ways to fix that. So direct instruction and coaching, learning logs, going back to that is a really good way to help remediate some of those deficits. All right, so improving student performance, feedback versus intervention. So really I consider these two things to be kind of different. Feedback is more from the perspective of here's how you're doing overall in the rotation. Here's some positive feedback. Here's some ways you can improve. Versus intervention, which I feel like is typically going to be earlier. I'm not going to wait till the midpoint. If you're doing something that's inappropriate, unprofessional. A couple of other things that have been done in the literature, actually last year in the same issue of Currents, talked about intention and reflective writing and academic success plans. And both of those really ask the student to think back to why they weren't successful and kind of write out a plan to help them be successful. I think the biggest difference, if I remember correctly, is the academic success plan actually came from the Office of Experiential Education versus the intention reflective writing was more at the level of a preceptor. So again, I don't have time to go through all of these, and if you want a copy of the slides, I'm happy to send it to you. Here are some feedback tools. So we talked briefly about the 1-minute preceptor. I've looked at some of these, and some are more applicable and helpful, and some are not so helpful. I thought the start, stop, continue was pretty interesting. So I continue these slides, and you can have access to all these PDFs in terms of providing feedback. Okay, so adapting your rotational learner needs. One thing that I think is really, really important is consider the timing and the setting of the rotation. A student who is in May, who is just out of the classroom, is probably going to take some time to really acclimate. There's a culture shock that happens. If it's their first time in a hospital, there's a culture shock that goes along with being in the hospital. And so I think it's important to recognize. One of the biggest pet peeves that I have is, if there's a student who just spent the last month with a different preceptor, obviously, and they come to me and they say, well, Dr. So-and-so does it this way. This is how I think you should do it. That's inappropriate to me. We're all different. We all have different styles, different ways to approach things. And that does happen probably every once in a while. I have a student who will come along and say that. Meet strengths and weaknesses with targeted learning. So if you see a weakness, if there's something a student really can improve on, then work around that. Provide them opportunities to improve on those areas of weakness and strength, but to a lesser degree, I would say. Rotation opportunities versus student interest areas. And so, if there's something a student could do at your site, and they've identified that they're really interested in a specific area, allow them to do that. I think it's going to make your rotation a lot better overall. And then finally, at the end, I think regardless of the setting, regardless of how interested they are in your rotation or not interested, you should be a model. You should encourage self-directed learning. All right, last couple slides. I know we're over time here. So when you're evaluating students, this is something I think is a really, really big struggle point for a lot of us. I know for me personally, objective data is more helpful than subjective data. So what I mean by that is, and going back to what we talked about very early on, that is, if you grade an assignment, you grade a journal club, you grade a patient interaction, that is more helpful in terms of evaluating the student than subjective data. So if you don't use those rubrics, if you just say, it seems like they did a good job on the journal club, I think there's more latitude there from a grading perspective. The second bullet point is really more my opinion than anything else. I think there's a lot of bias, and there is plenty of data to support this. It really says there is bias that occurs with evaluating students, and it is multivariable. Avoid solely positive feedback. So sometimes people need to hear hard feedback, and it really upsets them. I know I've fallen into the trap of, hey, you did a really good job with this, and not giving them something to work on or be constructive. So when you're evaluating students, some of the things I think you could consider, did the student progress from the midpoint? Is the student competent and capable of practicing without supervision? And then for some preceptors, minimum competency, just ask yourself the question, are your patients safe or are they in danger because of the care provided by the individual? I think those are really important to ask when you're evaluating them. But again, the more objective data that you can get, I think the easier it is and the better the discussion will be, because you can point back to, you did not perform as well in this area, here's the objective feedback. And again, if you use a rubric for anything, or you have collective feedback from a group presentation, it's also more powerful. So with that, I know we're a couple minutes over time. Questions from you guys, other questions from you guys before I give you the passcode?
David, I just say thank you. I thought there's some really practical tips there. It's not rocket science, and I thought you broke it down really well and gave us a lot to think about. Really enjoyed it. So thanks for taking time to do the program.
Yeah, absolutely. All right, so I'm going to type in my email address. If you want a copy of the slides, you can certainly email me. Be happy to send it to you. Well, thanks everyone. I know we probably moved through it pretty briskly. If you have questions, certainly feel free to reach out.